we have Jennifer with us, and we are going to hear her story and about the great things that she's doing for awareness. And we're really excited because she's quite a fireball. She's doing a lot, and we're really grateful on behalf of the community for what she's doing and trying to do. So, Jennifer, tell us about when you first heard about CDH and how you entered this awful world.
Okay, so in 2016, we went and we found out we were pregnant with our second baby. um, we went into just our local OBGYN, and we were going to see whether we were having a boy or girl and doing the anatomy test and everything, the anatomy ultrasound. And they were going through the hemispheres of the heart and the brain, and everything looked all right. And then she kept saying, and here's the diaphragm, and here's the diaphragm. And I even mentioned, like, after we were done, I'm like, Robert, why is she mentioning the diaphragm so many times? So when we got home, we had our doctor actually my OBGYN actually called. And as soon as I heard his voice, I knew that there was something wrong, because doctors don't generally make like house call or, calls to the house. They'll have their secretary do it or something like that. But he had told me that they had found a small hole in our baby's diaphragm, and that he was going to refer me to a hospital that was more equipped. They had a um, better equipment than what our local hospital did. So he referred me to Cabell Huntington, which is where that's where my oldest son was born. So I knew that they could pretty well handle, I thought, almost anything there. So we did our first ultrasound there. About a month later, um, I had they asked me if I wanted to do the amnio, and I told them no. I was afraid that it would risk um, one of the risks is miscarriage, and I didn't want to chance that at all for my own personal beliefs. He told me that it was he confirmed that it was congenital diaphragmatic hernia. So he said he worked with Cincinnati Children's on a regular basis. He was very confident, really familiar. He knew doctors up there by name, and I really trusted Dr. Chafin there. I really I trust him at Holzer or at Cabell Huntington. So it was really overwhelming. Those those days in between were probably the worst days. Not the worst days, but those days were really hard. Um, just not knowing, when you go on and you start researching and you find out that half the babies that have this are going to pass away. It's just it's not something that a mother should have to go through. As you know, um, it's it's uh, it's hard. But then we got to our team meeting. It was a 2-day team meeting at Cincinnati Children's. Our first day was mostly testing. We did the fetal MRI, and we did specialized echocardiogram of the baby, ultrasound. Um, then the second day, we met with each one of these places that we did had their own team that was involved in the rest of our care. So then we went the next day. We went to the geneticist, and then they all met together and discussed what would be best as far as treatment wise. That's when we had our team meeting, and it's really intimidating going in there, because you walk into a room, and although all of the people in the room are there for you, it's like, wow, like this is really you have a lot of emotions. It makes you feel a little bit more relaxed, because you have teams of people are there for you to help you, but then at the same time you realize the magnitude of what is actually happening. I always say my first one was my NICU trainer. We spent 10 weeks in the NICU with him. So the NICU stuff wasn't as hard for me to deal with, the NICU itself is a culture shock, in my opinion, for any mother to just, especially like a first-time mother, just to be in a NICU rather than being able to hold your baby right away and be able to, I had a very specific birthing plan. Like, I wanted him to come up, and I didn't want his umbilical cord cut right away, because I wanted that extra blood from blood in it, and I wanted him to come up and breastfeed right away, but not everybody gets those plans, and that's a really hard thing to deal with. But during this team meeting, like I said, there was over 20 people in there. They had the cardiology team. They had at Cincinnati Children's, um, I was a little bit high risk, so I wasn't able to deliver there. That's a children's hospital. So we actually had to deliver on the others. It was just on the other side of the block at UC Health. And that team was there also, and the NICU team was there. Um, did I say cardiology? The cardiology team, NICU team, the surgical staff. There was, I think, three of the many surgeons that they have um, at Cincinnati Children, and then they had, the residents that were learning about that being there to kind of go over. After my team meeting, I felt a little bit better because I was thinking that there was basically no chance for my baby to make it going into this. Like, I really was preparing for them to say the worst case scenario, but they didn't. Samuel had left-sided. His heart shifted all the way to all the way over to the right side. He had his intestines, his spleen, his stomach, and a little bit of the tip of his liver at that point up. They gave us a 95% success rate. They were confident that they would be able to handle it. And after that team meeting, I did like just breathe a sigh of relief. Although just being in there with all those people shot my blood pressure up, and it ended me in the hospital there just for regulation, just to make sure, because I like to say that my blood pressure is an emotional blood pressure. I definitely have that white coat. Whenever somebody comes in, it makes me nervous. It makes my anxiety stew. So we got released on Thanksgiving. Um, on Thanksgiving Day. My stepdaughter and my other four kids went on to the Thanksgiving festivities, and we went home washed up because I didn't even take a shower. We're like, okay, we're discharged. We got to get on the road. Cincinnati's about 2 hours away from where we live. So it was a hike to go back and forth. But coming out of the meeting, I really felt confident and more confident in the care that I was receiving at Cabell Huntington Hospital. And I felt more confident that they were going to be able to work together, that I wouldn't have to go to every single one of my appointments up at Cincinnati. So they followed up weekly with ultrasounds after I got home and everything, up until Christmas, when they wanted me to do a 24-hour urine, because I had a little bit of protein in my urine still, from the high blood. That's one of the early signs of preeclampsia, which my first had. That's why he was so early, or that's what I had during that. So Cabell also called on Christmas Day, and they let me know that there was protein and I needed to come in there. And now Cabell is a great hospital. They have a NICU staff there, but they do not have a surgical team. They do not have ECMO. Um, they're I believe it's a level 3 or level 4, but they just didn't have the capabilities to um, take care of Samuel's needs with his CDH. So I let them know that I would call and set up arrangements just to go there, because I knew that they were thinking that I was going to have to come in now and deliver him now. And based on what I read, I knew that if I had him there, then he would die. I knew that he had to be at a bigger, better hospital. Not saying that they're not a better hospital, they're just not equipped. So I did call Cincinnati, my team at Children's, and they asked me to come in right away. So the day after Christmas, we went in there, and I spent every bit of until after New Year's in the hospital, trying to regulate everything, my blood pressure and everything. So they got me into a place where it was looking pretty decent. And during that time, we lucked out by finding an apartment literally directly across the street from the Cincinnati Children's for cheap. It's not necessarily a great area from what I gather after, after the fact that it was we knew that we wouldn't be able to stay in the Ronald McDonald House because we have so many kids. So, and it was going to be a long-term thing, and we wanted to keep stuff a little bit more normalized for our kids so that they can come in up for the weekend and have. We were trying to make it as easy as possible for the kids as well, and so that we can still keep in communication because they told us it would be like a 6 month stay. So, um, luckily, we got that apartment. January 1st is when he signed the lease. And from that time on, they told me that I was not allowed to go back home, like home being, 2 hours away. So my home was across the street in our little apartment from then until I had Samuel on February 8th. I did have to go at the end of January. I had to go again, be admitted into the hospital. I started getting intermittent absent blood flow um, to the placenta, and they were worried about him not being able to gain. He had between they were keeping a really close track on how much he was weighing, and I was too. I really wanted him to be ECMO eligible, so that was one thing that because they really wanted me to have him a lot earlier because of the hypertension, but that was an issue for me. I'm like, no, I need to make sure that he at least weighs a certain amount to make sure that he's able to be on that. And we were able to resolve it with bed rest. I think I was in the hospital for 3 days then, and then we went another week. Um, until his birthday. The day that went in for, we were doing ultrasounds twice a week, and I was right across from the hospital. So I really felt confident that we were keeping a good indication.
Oh, we lost her. It's okay. We can edit it in. We could edit it back in. Where'd you go? There you are. Okay. I was just saying that we can just edit you back in like this never even happened.
So
Right.
we went to they were checking me every other week, or twice a week, to make sure that the blood flow was going all right. And the day that we had him, I went in, and because I had been through so many, as soon as she put the ultrasound machine on me, I started crying. Uh, it had started, the blood flow started to reverse, and it was time. Like, he had to come now. They were really concerned with him even making it. So we did that, and he did really, really well. He transferred really well. He had a little bit of jaundice. I wasn't able to go over for a couple days. Robert went directly over with them. Like I said, he had a little bit of jaundice. After the first day that I went in there, he was so beautiful. He was just the most perfect baby I've ever seen. And I have other babies, and they know that he's my favorite. um, they're okay with that. They're okay with being second and third and fourth, fifth, and sixth in line. It goes down. But but yeah, and when we got in there, I was looking him over, of course. I was taking him all in, and I noticed that his left foot was a little bit red and a little bit swollen. And my profession before this, years before this, I used to be a phlebotomist, and immediately I'm like, that PICC line's infiltrated. And they're like, oh, I don't think so. I'm like, his left leg's swollen. It's a little bit red. I'm like, no, it doesn't feel warm, but it looks infiltrated to me. And she flashed it. She showed me that it wasn't infiltrated. Um, then he developed a staph infection. And during that time, he had to have multiple transfusions. But that's when he got put on the oscillator. of course, one of the 3 or 4 times that I had to go home, he got um, sick, and I had that mommy guilt. Like, it's because he missed me. It's because you just like you just don't you just don't know unless you know, like that call in the middle of the night that something's wrong with your kid. You just So I left in the middle of the night and went back. Um, the oscillator was really loud. Um, it really agitated him. He didn't like it. He tried to breathe over it, but it was giving his lungs what was needed to fight that infection. After they were done with that, they found the clot from what I think is the PIC line that I had brought to their attention. But um, yeah, so he started swelling in his groin and leg area after that. Um, so when he was healthy enough after the IV antibiotics, among a wall of antibiotics, when he was healthy enough without infection, they moved his surgery up. In mid-March, that's when he got his repair, and his repair was done at the same time they needed to put in a Broviac port in his heart so that they can start heparin therapy to try to break up that clot. Now, through this, he did so amazing. Like, he just, any obstacle that was put in front of us, it just seemed like he just overcame it with such ease and grace. And when I would walk in, I would be like, "Hey, Peepers," and he would just open his pretty little eyes and just give me this really beautiful smile. He's my boy. But so let's talk repair day. So repair day was a hard day too. They originally thought that the repair was going to be 3 to 4 hours. So of course it ran like 6 to 7 hours. They didn't really have any complications at all. They weren't able to just sew him up. His hole was a little bit bigger. So they did the muscle flap repair, which is they take a piece of the abdomen and they cut a small layer of the muscle, and then they fold it over and then stitch it into place. This is a better repair than they like to do this over a alternative method because it reduces the risk for infection. And because it's your own tissue, it's easier to merge, they said, merge together. Um, Another one is the mesh repair, Gore-Tex mesh repair, which we were prepared for. And I really, whenever I was researching, I thought that was cool because my dad's worked at Gore before, and um, it was just like an ironic thing for me, not even knowing what CDH was or anything like that. It was ironic that out of all the material, it was the material that my dad had worked for in a company that my dad had worked for. So I thought that was really cool. But his repair went really well. Repair day was also the first day that we were able to hold our little boy, which I had begged for. I knew that I had to ask every day. Like, I knew that I've learned early on that the answer is always going to be no if you don't ask. So um, every day I would say, "Can I hold my boy today?" And every day it was like heartbreaking. But I knew in the back of my mind they were doing it for his safety and everything like that. But then the day came that we got to hold him, and it made me so happy. I instantly started crying, and then I started crying for another reason because I realized that, he might not make it through this surgery. They might be let me hold him because this might be the last time I ever get to hold him. So that's a hard thing too to deal with, but he made it. He made it through. He's my NICU rock star. It wasn't no time, and then I was holding him every day after his repair. He did really well. They warned us that some babies, they don't have enough room in their abdominal cavity after everything comes up into where where the lungs are and stuff. They warned us that he might have to stay open, and that that's a risk that they might have. Um, they call it tenting, and they would just leave it open while he would be able to grow into his intestines a little bit, but he didn't need that, even though a lot of babies, from what I read, do. Like I um he was a pretty amazing boy. After that, we really didn't have he did have we start after he got the Flolan off, then that and that, well, they have to wean the epi, and then that's when they start really the epinephrine to keep, because his hypertension was out of control, as most babies are. So they use epinephrine a lot to kind of regulate and help. Um, after so after he got weaned, they said that they could start with a little bit of feedings, which I was really excited about. I had been doing oral care, which whenever you're a NICU mom, like that's pretty much the only thing that you can provide. Like that's the only thing that you can really do for your baby, is just to be there with them, because their scent, you're their comfort, your touch and your scent, and you as a mom and dad are what comforts them. And it's hard that you can't hold them, but you can still put your hands on your baby, and you can still do the oral care, which was my favorite part of everything, because I produced that. I did that for him. And I was helping with that reduction of intubated pneumonia. They're at higher risk for that, and breast milk helps prevent infections is for that. So I was really excited whenever they were able to start feeding. His Repogel had to be put back in. He didn't like pick it up right away on the first try, and that was okay. I was expecting that too, but eventually he got it. After we really didn't have a whole lot of other bumps after that, except just the slow goings of like weaning his oxygen. He came home on no oxygen, which is amazing for babies like him. We had an NG. They showed us how to use the NG, and after he was taking half of his feeds, they they were confident, as well as I was, that everything would be a-okay. And we thought that this was just something that we were, you know, just in the past, like something that we got through, and we were going to move on and live our new normal life. And um, he did excellent. He did everything he was supposed to do. And through therapy and stuff, I realized that I did everything I was supposed to too. But as a parent, um, so about a month after we came home, it was my mom's birthdays right before Memorial Day weekend. Like it's always right on Memorial Day weekend, and my Samuel hadn't met my family in Wisconsin, um, his grandpa or his uncle. So we had an appointment at the end of the week, and we decided that we were going to take 2 days and drive up north to go meet Papa Bear and all of the rest of Samuel's family. We had a great visit. My mom had a nice, we had cookouts and stuff like that. He met everybody that was up there. And on our way home, about 3 hours into the trip, he started crying, a cry that we had never heard before. And we pulled over. I thought that maybe it was that we had been traveling too long and he just needed to stretch, and maybe he was a little sweaty, or maybe. So we ate, and I called the doctor, because I called Cincinnati and asked them if they could see him the next day. And we had plans on just going on to Cincinnati rather than going on home. We were going to we still had our apartment there. And they scheduled it for the next day. I went to the bathroom, and when I came back around, my cousin Olivia, that I have custody of, she said, Kay, which is my mom, she's like, Kay doesn't think that Samuel's breathing anymore. So I ran in there, and we immediately started CPR. There was actually a doctor that was in the restaurant. sorry. I they called 911, and there was a lot of traffic, but they were there like immediately, and I told them, I'm like, you have to go to a place that has a NICU. He has to be intubated. Like if he can't breathe, he has to be intubated. Like you have to go to a place with a NICU. And instead of going towards the NICU, they went 15 minutes the other way, away from the NICU. But they worked on him the whole time. We were there for hours. They got his heartbeat back. Um, I went through his medical history and everything, and I asked, like, when are we leaving? Like, we can't stay here. He has to be where there's a NICU. And they said that there was something wrong with the weather, which there was nothing wrong with the weather. And he came in, the doctor came in again, and I saw him going on the ultrasound machine again. He kicked the ultrasound machine into this other girl, and I knew. But I kept hope. Then finally they just all looked at me. He said, I'm sorry. Like, do anything, give him epi, do anything. Like, he's just a baby. Sorry.
No, you're
So,
doing great.
so months later, we found out they sent us his autopsy. Well, I should mention, everybody was so sweet. An organization that I still don't remember. I still don't know who it was. Paid for a hotel room for us that night until we could talk to the coroner the next day. The funeral home there, they took care of everything for us. I just sat there flipping and flipping and flipping, and he's like, do you have any questions? I'm like, I'm not even looking at any of this stuff. I'm like, I'm sorry. I haven't even planned for my own funeral. I don't know how to do this. But he was sweet, and he gave me some advice. He said that he had a family member that had passed away, um, and she regretted burying her baby because she doesn't get to the gravesite like she wants to, and she has guilt over that, and she wishes that she just had her cremated. So that's what we decided, and they paid for everything. We didn't know that until after we decided. That's when they told us. They were really kind. But about almost a year, like it took forever to get the autopsy back, and it was complications of rhinovirus, which is the common cold. That's what he passed away from. He didn't even have a snotty nose. He didn't even have any. He was tired. Like he was just tired. So, yeah. Sorry.
No, I'm
That's my
sorry.
voice today. No, it's okay. I'm sorry too. I hate, I don't know what to say. Like when people say they're sorry, like, leave me here. I know. I wouldn't wish it on anybody. Um, it's just an awful, awful thing. So it's important that we spread awareness. Um, we're part of the Dream Foundation or the Dream Program. I'm not sure what they call it, out of Columbia University. When Samuel got repaired, they took a specimen from him and me and Robert, his dad. So hopefully, maybe they'll find someday. We'll find out why this happened to us. We haven't been marked with any other indications. Like he didn't have any other anomalies that they found. Like they didn't find anything wrong with him other than the CDH. So it's hard. Um, and as a parent, when you're, I know that I didn't do anything to make this happen, but you definitely feel bad. You feel like you didn't protect your kid. Although I have other kids and stuff, I feel like a failure as a mom, and I know that I did everything I could.
You didn't even have
You
any
know, sometimes
symptoms.
it's not enough sometimes. So
Hey, you, Samuel's story is so much like my Shane story. It's so many, their deaths are
well,
so much alike. You're, no, I'm so sorry. But you had no clue. I mean, rhinovirus with no symptoms, that's just horrific. That is every parent's nightmare. And I am so sorry you lived through that. That's nothing
yeah.
anyone should ever have to go through. Um, you're doing so much in his memory, and I want the audience to know you're missing your birthday dinner to be out in the car telling the story to us, and we appreciate
And
that.
it's
And
my birthday. Thanks for
happy
mentioning.
birthday.
I'm not allowed to tell anybody I'm over 29, according to my friend Michelle, because we're born in the same month. And if I blow the cover, I blow it for all of us. So 29 and holding.
Oh, well, thank you for sharing your birthday, telling us about Samuel's life. We're really honored. Thank you. And
It's an
you're,
honor to me
well, I hope
to
to
be
see
able
you
to.
in Nashville. I really do.
I
Um,
just told Rob that's what I wanted for my birthday was my ticket. I'm like, can you just book it so that I can have that peace of mind. I do
good,
plan on attending. I'll give you a big hug whenever
good,
we see each
absolutely.
other in
We
person.
I hug a lot, so it's good. I'm a hugger.
Me too. It's
Um,
awkward sometimes, but it's
oh,
okay.
I do it anyway. And you're doing a TV interview after this too
Yeah,
today, right?
WSAZ out of Huntington, West Virginia. They're in the tri-state West Virginia, West Virginia, Ohio, and Kentucky. We took your advice and lit up our bandstand in Galpla City at the city park, and our county is issuing the month as CDH Awareness Month, and 19th is the CDH Awareness Day. So we're trying to do our part. I'm going on the radio station every Wednesday in the morning. I mean, it's the same station, but I go and talk to two different people there about CDH and what it is. And I flubber through it sometimes and I mess up my facts sometimes. I have to go back over because I'm so nervous, but I'm just a mom. I'm not anybody special or anything like that. I don't have
There
a
you are.
educated, I'm not a doctor or anything like that. I'm just trying to speak on my experience and the experiences that I, uh, the information I've gained from other people's experiences, and I'm just trying to do my best. And I encourage everybody to like go out and research and find out what this is and what it's about, and make sure that we can spread awareness and get the funding that we need, at least at least a dream, so that I could find out what happened to my boy anyway. So,
Yeah,
but everybody, I mean, it's not just Samuel. It's, I mean, your Shane was what, 9 years old? Like 9
6.
years or six? 6 years though, like 6 years of wondering what happened and going through everything, the health stuff that goes along. You basically lived in the hospital. You lived in the hospital for at least 6 years on and off.
Yeah,
And this is what parents have to deal with. And I don't know, my story, Samuel's, one of 800 for his year. I don't, we just, it's heartbreaking.
it
But
is. And we'll work together, and along with Dreams and the Mass General Genetic Study and the study at University of Toronto and the study in at the University of Utah. There's several studies,
yeah,
and they're going to be
I'm
speaking in the telethon too.
learning.
Hmm?
Awesome. I'm learning about more. Like I didn't know that there was any other one besides Dream. That's the one that we were, that's the one that they put us in. So I have learned about more.
Yeah.
Thank you, because a lot of my information does come from you and your website and what you and all of us have created, really. But
Yes.
I
It's
really appreciate it. I appreciate you
well,
talking with me. I cannot wait to meet you in July, right? End of
Yes,
July.
in July. And I can't wait to meet you. I will let you go join your family. Thank you so much
Thank
for sharing
you.
Samuel's story. Please keep up all the work you're doing, raising awareness. You're doing a great job,
Thank
and
you.
we're
You
all very proud
too.
of you. Happy birthday, and I'll talk to you
Thank
soon.
you.
Okay,
Thank you. Talk to
bye-bye.
you later. All right. Bye
Okay,
bye.
bye.